Assessment Sleuthing Journal by Melissa Pearson. The community I chose to look at is Des Moines, Washington. It's a community which I grew up in and still frequent quite a bit. Population is over 32,000 people. The area size of Des Moines is 6.3 by 2.1 miles, or 4,340 acres. In the map here, you can see the red outline of where Des Moines is. It's located next to the water, and it borders with Federal Way, Kent, and SeaTac. Healthcare access. Since Des Moines is a smaller city, there are some services that are not offered within Des Moines, but are offered by neighboring cities. Within Des Moines, there's a Health Point clinic, has primary care as well as dental. Within that clinic is a Valley Cities clinic, which is mental health services. We also have a CMAR that has primary care and dental, as well as some temporary housing. We also have UW Medicine, which is primary care and urgent care. And in a neighboring city, Burien, we have St. Anne's Hospital, formerly known as Highline Hospital. The public health services that service the city of Des Moines are in a neighboring city in Kent. It is the Kent Public Health Center, which is a county organization or office. And the services they provide there are Women's, Infants, and Children's Nutritional Program, also known as WIC. They do maternity screening and case management. There's a teen clinic and birth control, STD clinic, and emergency contraception provided. It also helps people connect with services for those who have children with special health care needs, and they help with ORCA lift cards for people's transportation needs. What's needed? These services are very close to Des Moines, but not within Des Moines. It's debatable whether or not these services need to be actually offered within Des Moines, seeing as they're still accessible to the population of Des Moines. Vaccinations and vaccination rates. The vaccination completion rate for children entering kindergarten in King County, Washington, is 90.1%, which is below the national average of 94%. King County, Des Moines is one of the cities within King County. Obtaining vaccines. Vaccination can be obtained without health insurance at the local Safeway, Fred Meyer, Rite Aid, and Walgreens pharmacies, and at the CMAR clinic. For obtaining flu shots, free flu shots can be obtained at the local Safeway pharmacy during flu season, as well as the other free vaccination sites mentioned. Disaster planning. Des Moines has a comprehensive emergency management plan. You can find more information on the website, which I've listed here. This plan includes plans for multiple types of disasters, which include earthquakes, flooding, plane crashes, severe weather, terrorist attacks, and more. Des Moines is a city that is underneath a very common flight path for the very well-frequented local airport, international airport. The plan also defines levels of activation of emergency operations. It says how people will respond and who will respond. And it talks about shelter, resources, and logistics planning. Education and promotion, including health messages. There's not a lot of signage within Des Moines. They have very strict rules on that. I did find some notices to the public on the Des Moines Activity Center billboard that include fitness and some other health-related things. There was also a sign up promoting a free 5K walk run done weekly. These are other health messages or calls to action that I saw within Des Moines. One is a Walgreens sign that is talking about their COVID-19 testing. And then there's a Safeway with a pharmacy that has signs in it, including um, something promoting the shingles shot. Engagement. I did not find much else in regards to calls to action. There were things about vaccines and about testing. Like effectiveness, these are more so notices rather than motivation or true calls to action. The source was from pharmacy and retailers rather than the county or public health themselves. A reflection on the services I found while conducting my sleuthing assignment journal. Des Moines is a relatively small community compared to the communities that it's near. So it does seem to have fewer services than the other communities and relies a lot on these neighboring communities' services. As far as rating the level of service, it seems that there are adequate services for the community members if you include those that are in neighboring cities. But as far as education, promotion, calls to action, that does appear to be subpar. As far as what I've seen in the neighboring communities, it does seem to be a lot less. There isn't really a visible, active effort to educate the community about health or to get them to do anything to improve health or prevent disease. So I would say as far as what's needed is more of those things. Thank you for listening. The following are references.